In traditional Chinese medicine, TCM, fatty liver is not understood exactly as in Western medicine, but is related to imbalances in internal organs, especially the liver, spleen, and kidney, as well as the accumulation of phlegm, dampness, and liver qi, energy, stagnation. Here is an explanation from the perspective of TCM. Causes according to Chinese medicine. Spleen imbalance, pancreas in functional terms. The spleen is responsible for transforming and transporting fluids and nutrients. If the spleen is weak, spleen qi deficiency, it fails to metabolize fluids well, leading to dampness formation and eventually phlegm. This phlegm dampness accumulates in the liver, causing fatty liver. Liver qi stagnation. Emotional stress, repressed anger, or chronic frustration block the flow of liver qi. This stagnation prevents the liver from properly regulating fat metabolism, favoring fat accumulation. Inadequate diet. Excess of greasy, sweet, fried, or cold foods damages the spleen and generates dampness. Overeating or irregular meals worsen the problem. Kidney yang or yin deficiency. In older individuals, there may be a decline in kidney yang, which affects general metabolism and the body's transformative capacity. Sedentary lifestyle. Lack of movement contributes to qi stagnation and phlegm accumulation. Common symptoms, according to TCM: sensation of fullness or distension in the side, hypochondrium. Constant fatigue, due to spleen deficiency. Nausea or oily taste in the mouth. Tongue with thick, greasy coating, possibly with teeth marks on the edges. Slippery or tight pulse. Central obesity or unexplained weight gain. Irritability or depression, due to liver qi stagnation. Side effects if untreated, TCM view. Progression to blood stasis, which may lead to cirrhosis or liver masses. Systemic imbalance, insomnia, anxiety, chronic digestive disorders. Increased risk of diabetes, related to spleen deficiency and phlegm dampness. Progressive weakening of qi and vital energy, zhen qi. Treatment in Chinese medicine. The treatment aims to strengthen the spleen, soothe the liver, eliminate phlegm dampness, and activate qi and blood circulation. Chinese herbal medicine. Chen Tang, 2-cured decoction base for eliminating phlegm dampness. Chai Hu Shugan San, to move liver qi. Shan Jia, hawthorn, and Zi Xie, a lisma help dissolve fats and improve metabolism. Ban Xia and Fu Ling, reduce dampness and strengthen the spleen. Note: herbs must be prescribed by a TCM professional, tailored to your specific pattern. Acupuncture. Key points. Liv3, Tai Chong regulates the liver. SP6, Sanyin Jiao strengthens spleen and eliminates dampness. ST40, Fenglong eliminates phlegm. GB34, Yanglingquan harmonizes liver and gallbladder. Diet. Avoid fried foods, dairy, sugar, alcohol, cold food, like ice cream. Prioritize cooked vegetables, whole grains, like millet, brown rice, legumes, cucumber, pumpkin. Cook with ginger, cinnamon, or turmeric, they help transform dampness. Gentle exercise, daily walking, tai chi, or qigong to move qi and prevent stagnation. Emotional management, practice relaxation, meditation, or conscious breathing to release liver qi. Personalized recommendation, by age. In cases of slow, heavy digestion, frequent thirst and hunger, there's a likely combination of spleen qi deficiency, accumulation of phlegm dampness, possible yin deficiency with empty heat, due to thirst. A gentle approach with proper diet and acupuncture will be more effective than aggressive treatments. Subscribe, hit the bell, and comment for more informative videos of your interest.